What is depression? Depression is a category of psychological disorders, varying from temporary and least effective to the more complex and life-altering forms. The definition of depression. The most common form of depression is the major depressive disorder, medically defined as a combination of symptoms that interfere with a person's ability to work, sleep, study, eat, and enjoy one's pleasurable activities. Physiologically, it is a chemical imbalance in the brain that restricts normal emotional reaction to stimuli and consciousness. As seen by the brain activity scans, a depressed person has significantly less synapses of thought and emotion. For the forms of lesser complexity and life impact, there is minor depression and dysthymic depression. Minor depression is the least scarring of all forms of depression. In fact, this form lasts longer than a week, but no more than a month. It requires minimal to no treatment and passes in time. Most people refer to this as a bad week or a funk. Dysthymic depression is a lower form of major depression, because it is significantly less debilitating and has more regions of the brain active. However, it lasts and requires treatment to make the brain fully functional. It does affect normal and emotional function, just notably less. Now for forms of greater complexity and life impact. Psychotic depression is commonly mistaken for a form of schizophrenia. Schizophrenia gets worse as time progresses, but depression is easier to treat. Psychotic depression is typically present during high levels of stress, or coupled with anxiety. It results in negative hallucinations that are usually dark and startling. Visual hallucinations are more common than auditory hallucinations, but they are just as likely to experience as tactile and smelly hallucinations. Next. Postpartum depression is the result of mental exhaustion from the physical stress of birth and being obligated to care for a child. It can be a result from the unexpected experience of raising a child or the feeling of detachment. This also applies to mothers who aborted or gave to adoption. Next, in complex forms of depression, seasonal depression. This can take form in minor, major, or dysthymic. It gets progressively worse during one half of the year. This half is usually fall and winter, when people attend to stressful jobs and academics more often. An uncommonly associated mental disorder that is part of the depressive group is bipolar or manic depression. It is popularly unrecognized as a form of depression and consistently misrepresented as constant mood swings, when in fact it is actually periods of positive and normal function followed by depression. It is consistent, but the periods of depression tend to last longer than the positive highs. A PowerPoint project completed by Samuel Turso and utilized the National Institutes of Mental Health as reference material